Today we heard some very promising news showing that treatment with Remdesivir, an experimental antiviral drug, might be speeding recovery in patients infected with the coronavirus. And today Dr. Fauci said there is a, quote, clear-cut benefit to the drug, at least from what they've seen so far. So let's talk about it with our 9 Health expert, Dr. Payal Kohli. Of course, Dr. Fauci has been very cautious about other drugs like hydroxychloroquine, many people waiting for more results. But what did we learn today about Remdesivir, Payal?
So, Tom, this was the largest study of Remdesivir to date. So it was 1,073 patients, and they were divided half and half between half that got placebo, which is a sugar pill, and half that got Remdesivir. And they looked at many different outcomes, the primary outcome of the trial being the duration of the illness. And what they found was that those who got Remdesivir actually had a 31% reduction in their duration of illness. So they were hospitalized for 11 days as opposed to those who got placebo, which were hospitalized for 15 days, and this was statistically significant. They also looked at the mortality rate or the death, and they saw an encouraging trend there as well, that the death rate with Remdesivir was 8% as compared to an 11.6% death rate with the placebo. But take note that this was not statistically significant in this trial of 1,073 patients. So what we know is that the drug is doing something. It's reducing the duration of hospitalization. It's certainly not a cure. It's certainly not going to fix all the problems, but it is very positive nonetheless.
Yeah, when you talk about treatment and mortality rate, this is not a vaccine. This is not preventing anything. This is for people who are already sick.
Exactly right. So that's an important distinction to make. This was an intravenous drug, and the only context that it's been studied in is in people who are hospitalized with this illness. Some who are critically ill and on ventilators, and others who are, more moderately ill with the illness. So definitely not something that can be used preventively at home or even for those with mild symptoms at this point.
So what did we learn, if you could summarize what this Remdesivir study may be teaching us?
So the Remdesivir study tells us that this mechanism of action of Remdesivir, which is to inhibit viral replication, may be a promising target for us moving forward, that it may actually improve clinical outcomes. It also tells us that, it's a little bit different from what we've been hearing about the prior studies of Remdesivir. And the scientific explanations for that could be because this was the largest study, so it had more statistical power. The patient population studied here was a little bit different. And then the timing of Remdesivir. So it's almost like the Tamiflu. You want to try to really catch it early after you get infected with the illness rather than late, because late it may not have as much efficacy.
So Dr. Fauci, many people in medicine have been very cautious about going forward with endorsement of any of these drugs that we've heard about of late. But again, Dr. Fauci, today using the term a clear-cut benefit to reducing the duration of illness, let us know what that means as far as, hearing it from him especially.
Well, what I was really struck by is that he said this should become the standard of care. And that's a pretty dramatic statement to make, and not something that we would normally make lightly. And I think the reason that he's really saying that is because at this point we don't have any other options. And this is the first drug that's shown us in a very rigorous randomized fashion. So this was a great study because it had a control arm, and we saw the difference between the people that got the drug and didn't, that it shortens the duration of hospitalization. And that's a significant endpoint. So, people are in the hospital less, so they have less risk for secondary infections. Obviously, that's an important endpoint when it comes to hospital resources as well, in terms of ventilator use, hospital room use, and other such endpoints. And then it's starting to suggest a potential benefit towards a mortality benefit. And it's possible, again, if this trial was bigger and had more power, that we could actually detect a statistically significant mortality benefit. So, we'll have to wait and see as we get more data on Remdesivir, but now that he's made that statement, people are going to start using Remdesivir as a standard of care. We will get that additional data. And the other piece of it is that it relatively is safe. We didn't really see a lot of safety signals emerge from what the company's press release has said. But again, as more and more people get enrolled in the trial, we'll see if that really holds true or not.
And just to be clear, this is a drug you would need to be hospitalized to get. It's an IV drug. It's not something you can buy over the counter or take on your own.
Absolutely right. Hospitalized, moderately ill, and it's an intravenous drug. So don't call up your doctor and ask for the drug. And again, it's not quite at that stage yet where we think it's going to prevent illness or that we can use it in people with mild disease. There's no data there.
So today, Governor Polis was talking about increasing testing so much here in Colorado because we're turning the calendar into May on Friday, and he says we'll be tripling how many people we can test here. What is that going to do as far as Colorado and how testing is done around the country?
So, Tom, there's really three goals for testing that the governor went over in his press conference. The first is to identify those that are sick. The second is to identify the hotspots in the state. And then the third is to protect the vulnerable population. And a Harvard study just came out this week that said in order for us to achieve those three goals and to safely and viably open up the economy again, by early June, we're going to need to be testing 2% of the population. So on a national context, that means we need to be testing 5 million people every single day. And here in Colorado, 2% of our population is 116,000 tests a day by early June. So I'm happy that the governor is agreeing that we need to increase the testing. We're currently at 3,000 a day, and we're expected to go to 8,500 by the end of May. But 8,500 is still a ways from the 116,000 that the experts are saying that we need by early June, and several more that we'll need later as we continue to relax these social distancing guidelines.
And we'll see what these testing numbers tell us as we do, in fact, increase the testing. Dr. Payal Kohli, it's always good to talk with you. Thanks.